As nursing director, I do a lot of case management. I also supervise the clinical field staff. I've worked in home health for about 7 years now, and I've worked with several softwares. And I'd have to say that Kinnser Agency Manager has been the easiest to use.
We know the skill sets of our users, and we knew, it being easy to use, user-friendly, intuitive, that wasn't by accident. The application really models home health well, and the back and forth, the workflow, the entities that are in home health, which are patients and episodes and visits, and those things are modeled really well within the application. So they're learning technology, but they're learning it in a paradigm that they understand.
It allows you to run an agency with fewer staff and be fully confident that you're not missing anything. You are able to communicate and coordinate the care that you need to through one software.
There's not a person in an organization in a home health care setting that would not have their job function actively using the application.
I think it makes our jobs more efficient. There's a lot less stress when you're in the field or in the office. You don't have to run and pull a chart. You don't have to make several phone calls to answer a question regarding a patient. You have everything just within seconds at your fingertips. There is an inner software email called the K-Mail or Kinnser Mail, where you can communicate with your field and administrative staff.
It allows HIPAA-compliant messaging to occur, but it also allows us to append those messages to a patient's chart.
You can see the entire episode, patient demographics, medications, pretty much everything that's going on with that specific patient.
So a patient chart, we typically think of the formal documents. You're going to have a med profile, the OASIS, the nurse's notes, the PT notes. And that's true in Kinnser as well, but we also have the K-Mail notes that are attached. So you, as you're doing a end of episode review, for example, you have access to all the K-Mails that have gone on back and forth about this patient.
It's been an easier way to manage the patient's care without lacking in any areas. Not every nurse sees the same patient week after week, so when you have multiple field staff seeing one specific patient, you can really see in its entirety what's going on with the patient. Having to fill in paper documents, having to turn in paper documents cuts back on the amount of time that they're spending in the field, and they're able to submit their documentation immediately. We have the nurses turn in their paperwork once a week. Well, this way they can turn in their paperwork daily. We can bill daily. I
think a lot of people are not hesitant, but surprised at how little effort is needed to bill.
I'm very biased because I use it. I'm not the kind of person that, will speak highly of it and not ever use it. I use it daily. We
have really happy customers. It's a lot of fun. When we get feedback from customers, it's typically professional, it's in a constructive manner, and it's them wanting to be a part of what they feel like is a collaborative effort to make an application better.
We're able to really focus on the patient care through this one software.